Ever wondered what those tiny bumps on your arms and back are? Well, this is for you. Keratosis pilaris is a skin condition that affects the teenagers, and it starts as small tiny bumps on the outer aspect of the arm, the back, and even on the buttocks. This has a genetic tendency, and here the hair follicular epithelial keratinization gets affected. If I want to put it in simpler terms, it's just a blocked hair follicle. So we do see tiny bumps. Sometimes we also see a whitish plug coming out of those follicles. Practically, most of the patients have no symptoms due to this, and it's only cosmetic concern. This tend to get worsened in dry skin conditions like in winter. Now, whatever we have treatment options are only to reduce the severity. You need to understand there is no cure for this condition. Most of the patients, people often confuse it with acne. No, this is not an acne. There might be slight redness, but we don't see pus collection. We don't see a big bump. We don't see a painful bump. Most of them are similar looking tiny bumps with a white plug which might have redness in them. Now the treatment options are, first and foremost, you need to moisturize the skin. Moisturize. So use a body wash or a soap that is hydrating. Use not a normal moisturizer, something which lasts longer on your skin, which has ceramides or peptides in them. Don't meddle with them. The more you meddle, it might get infected and then you can have pus. All the treatments are based on the concept of peeling those bumps away. But yes, the new skin that comes can again have bumps. The treatment options are keratolytics like salicylic acid, glycolic acid in cream form, chemical peeling, urea-based creams, resurfacing lasers like CO2 laser. But you need to be aware, most of these lasers do provide a significant improvement with little downtime. So I hope this was a useful information to you people. So like, subscribe and share for more updates. Thank you.